We're live.
Hey guys, it's Dr. Emer, and we're doing a great case today. As you guys know, part of my practice is laser resurfacing. Coming close, I'm going to show you. One of my clients had basically full body transformation. He's been undergoing over the course of years so much weight loss, and he's been working to really define his body, make himself in the best shape and best health possible. So we're now about 6 weeks after you see what we've done. Chest lifting, arm lifting, body lifting, thigh lifting. You can see the scars everywhere. The ones that are red already, those are the ones I've done Fraxel and VBeam on. Those are two different types of lasers. The VBeam works to decrease the thickness and redness. And the Fraxel, if you look really, really, really close, forms little teeny dots of heat inside the scars that over the course of the next 3 to 5 days will lightly speckle, peel, and remodel. And what happens with a lot of the scars, especially over areas of movement, there's some webbing that forms, there's some scar tissue that forms in induration underneath. So not only the appearance of the scar do we want to improve, we also want to improve the under part of the scar so it makes it easier for him to raise his arms and just have an overall better movement in his body. Zoom in right here, you can see a lot again of that Fraxel. You can see the dots that are in the skin. Fraxel is a non-ablative laser. There's two different types on here. The deeper setting that we're doing right now for scars, and I'm going to show you guys on here, doesn't really hurt that much. Hold on 1 second, let's get ready. Doesn't really hurt that much, but develops a lot of heat. And you can see as I roll, you get a little beeping. And that beeping is basically forming little dots in the skin of heat. How does it feel? Does it hurt or no?
No, I mean, it's
not the best thing in the world, but
it's not the best thing in the world, but honestly, it's like a light treatment of laser hair surgery. I mean, laser hair removal. Yeah, I mean, it's not
So
that
some people it's worse than others. This is going to help us remodel. The first treatment we do a little bit lighter. The second treatment, which will be 3 to 6 weeks from now, we'll do a little bit stronger. But he is honestly bionic because he's healing so fast on his own, which is unbelievable. At 6 weeks, most people cannot lift their arms like this. They usually have a lot of hardness here and a lot of webbing, make it very difficult for him to lift. And what you guys don't know before is I could literally pull all of his skin, and now it's all. So this is an extensive surgery that he had, and I'll tell you, it doesn't come easy. There's a lot of things along the way, like opening of wounds and healing of the scars that take time. So he's going through that right now. So this is, again, a life change, and modifications can be done 3 to 6 months later if needed. But he's healing so well that what we want to do is just get him through this phase, see how it heals, get him back to exercise, and then take a look 6 months to a year and decide, do we want to do any tweaks with more muscular defining or shaping, whatever it is we want to do. But we got to keep doing these scars so the skin heals properly. What are they saying on there, guys?
They want to know, will the laser make the scars peel off, or how does it fade it?
No, we just talked about that, guys. This is going to form little dots in the skin, and every time those exfoliate, it will lightly fade the scar. So if the scar was going to take a year to heal, it probably is only going to take 6 months to 9 months with the laser. So you guys can see here, look, now all that redness is popping up because of the swelling and the heating in there. Now I'm going to do a little bit around the edge of this nipple.
Do you use a numbing cream?
Yeah, we used a numbing cream beforehand. It still hurts a little bit, and he's super strong. He's been through, obviously, these major surgeries, so he knows about pain. About pain, especially when you do a thigh lift. You guys, just so you know, thigh lifts and body lifts are really difficult for people to handle, and he did amazing.
And one thing is that you don't want to rush to judgment right away. It takes so much patience and understanding of what it is that you're putting your body through. And
I agree.
And it takes time, you know.
I always tell people, we assess. Let me grab that. I'm going to give him this. Hold this in your hand here, this tube. Now below the cold air. The key, you guys, and I did all the initial studies with Fraxel, is the key right now is to get the skin really cool, because there's a lot of swelling that occurs. So he sits for 5-10 minutes and cools, and then we do, if he wants, we can even put a little red light on him, decrease the inflammation, And then he just goes to skincare. His big thing now is compression and following healing protocols. And that's it for the next couple months. Then he exercises, then we reassess the body. But the key is lasering early on. If you don't laser early enough, 3 to 6 weeks after surgery, the scars can hyperpigment, they can thicken and form webs. They don't form as good of a result. So you see, like, look, right now it's getting really slim and thin. But by doing this, all these little outside areas, all this will tighten and it will blend so much more. So it's truly important. That's why I thank him for showing you guys the importance of doing lasers after cutting surgeries, after traumas, burns, etc., because this would give you a better outcome. And obviously it's very important to go to someone you know. That knows lasers. Scar tissue actually absorbs heat much more than regular tissue. If you did the same energies on a face, you could burn through the scar and worsen the scar. So you have to understand scars. Scars tend to be what I call a heat sink. They'll hold the energy too much. So you really have to know that's why doing this cooling air and doing it properly is really, really important.
Is it important to keep the scars moisturized?
Yeah, very, very moist. We do growth factors specifically. We use my Refit Face, which is designed to heal burns. It's at emeragecosmetics.com. Doing silicone gel and doing stem cell therapy. So those 3 things are really the most important. Now today I'm going to add in for him actually a retinol foam and a brightener, because that will help them turn it over a little bit faster. You can even get a quicker result. We typically do that like 3 months, but since he's already had like a 3-month healing time period, we'll start that a little bit sooner. But other than that, he's doing great.
Do you use fibroblast?
You can do fibroblast injections. I find that it's not even really worth the price. And the fibroblast or plasma pen, you would not use that on this. This needs to be healing. We don't want to damage it. We don't want to induce damaging heat. So again, take a look up close. He's cooling now. We want the redness to go down. But all these areas have now been lasered. And the goal is to remodel those scars so they're basically invisible at a year. Have a good day, guys. So yeah, why don't you cool a little bit, I'll come back, and then we'll do a show. We'll do a little